Thanks for tuning into the Finance News Network. Today I'm with MedAdvisor CEO, Robert Reid. Hi Robert, and welcome to the network.
Thanks Jess, nice to be here.
Thanks for coming. So for those who aren't familiar, just give us a quick introduction to MedAdvisor.
MedAdvisor was founded in 2012 by someone who's really frustrated with the paper-based health system and the dependency that created on other people within the health system. And so his mum was battling many different conditions and was trying to work out scripts and how to manage scripts, how to order her meds when it all ran out. And he just thought, this is ridiculous. In a time where we can do mobile banking and everything's in the palm of our hands, why can't we do that with health? So MedAdvisor was born. What MedAdvisor does is seamlessly connects a patient with their pharmacy. And that means they get an automated medication list whenever they need it. So if they need to go to a GP, see a new doctor, go to hospital, they have a history of their medication in the palm of their hand. It also allows them to order their medications from over half of Australia's pharmacies, and that's a really big convenience proposition. So the combination of having control of your medications and the ability to have convenience was a really strong value proposition, and we've seen that take a lot of market share and being able to grow the pharmacy market to over 50%.
So what are the problems, Rob, if people don't take their medications as prescribed, and why do you think these problems are occurring?
Some medications that you take every day, if you're not adherent to at least 75%, you can increase your risk of stroke or heart attack or even death by up to 4 times. The World Health Organization estimates that there's about 50% of the pills that are prescribed are actually taken. So doctors suggesting you take a medication and people are compliant with that about half the time. In Australia, we've studied about 1.3 million Aussies, and we see that number to be about 54% for chronic medications. And these are patients who are not on MedAdvisor.
So speaking about MedAdvisor, your platform, who are the users?
Most common demographic is 40 to 70 years old. More females than males on the platform, but because we have carer mode, we can extend to patients that are less than 10 and patients who are over 90. So you can care for your mum or your husband or even your grandparents and your kids, all on the one account, and that makes it really easy for people who are looking after others.
And Rob, what are the key features of your platform?
It can work in mobile, apps, and certainly consumer web. We also have SMS reminders and landline reminders for those that prefer those methods of communication. So really it's available to anyone who's on medication. The interesting thing in Australia is 50% of Australians have a chronic disease. So that's 12 million people. So really there's a very wide audience for people who are taking regular medications. Then when you are taking the regular medications, you also have the ability to have a medication list that's up to date and constantly updated, and that happens because we integrate with all the dispense systems in the market. We also have the ability to order your meds, so you don't have to wait when you go to pharmacy, or indeed if you want to skip the queue at the GP and it's a regular medication that the GP is happy to prescribe without you being in attendance, you can do that through the app as well. So we really enable that convenience, that control and that information to come back into the hands of the user.
Thanks Rob. Now tell us about your financials.
Our revenue has been growing very strongly. We were up 51% last year and we turned over about $7.4 million. We have high and expanding gross margins, so they're now tracking in the high 80s%. And as a core business, we are now profitable when we're looking at excluding the growth investments that we're making in our platform. So we are investing heavily in growth, and that's an area that we report separately.
So you mentioned how big the market is, but can you quantify that? What's the size of the opportunity and what's your strategy?
So the size of the opportunity is significant because at the moment we see about $260 million worth of scripts ordered through the platform every year. There are about $10 billion worth of scripts ordered in Australia or taken every year in Australia. So it's a very big pool of medication. We're just scratching the surface of that. So we see an opportunity to grow to a larger proportion of the 12 million chronic patients in Australia. We are averaging about $7 revenue per patient per year through the platform, through all our revenue sources. We'd like to maintain this as we grow into those sort of numbers.
Thanks, Rob. So obviously you are investing for growth, but is the company fully funded?
Yes, we were very fortunate in that we received $9.5 million last year from the large healthcare company EBOS to really accelerate our growth. They invested at 5.75 cents per share. As a result of that, we are fully funded. We have $8.7 million worth of cash in the bank to go and pursue these growth initiatives over the next 12 to 18 months.
And just lastly, Rob, you've talked a lot about opportunity and growth, but where would you like to see the company in 12 months from now?
Yeah, we want to really grow our pharmacy engagement. We have a great platform that's really deeply ingrained and integrated in the pharmacy workflow now, and we want to extend those opportunities to reach more patients and to run more programs and services for the 8 million patients at our pharmacies, and building significant opportunity around that to take our product globally.
Wonderful. Robert Reid, thank you so much for your time.
Absolute pleasure. Thanks for having me, Jess.